Welcome everyone to the annual Outreach Worker Training 2021, brought to you by the Michigan Interagency Migrant Services Committee's Outreach and Education Subcommittee in partnership with the Michigan State University School of Social Work. My name is Audra Fuentes. I'm a departmental analyst with the Office of Migrant Affairs with the Michigan Department of Health and Human Services. And we are excited to bring you this training with important topics and resources available to agricultural workers in the state of Michigan that you can use during this season. Like Eric, our presentations and materials will be shared in the chat for your viewing. And today the presentation will be recorded and the link will be shared by request and with attendees. So we are going to get started. We had a slight change to our agenda. The governor's office is going to present after our keynote speaker this morning. So our first presenter today is Dale Freeman, Director of the Office of Migrant Affairs with Michigan Department of Health and Human Services, to give us an update on coronavirus testing. So, thank you, Dale.
Great, thanks, Audra. Thank you for the introduction, and thank you for everyone for coming out today. Appreciate to see so many people, almost 85 now. I'm going to share my screen. I have a brief PowerPoint that I'm going to be working through, and so I am going to share that. So move that here. Are you seeing my PowerPoint?
Yes.
All right, very good. So for today's training, we're going to talk about what's happening in the world of testing. And I think it's important to look at this as through the coronavirus lens from when the virus became active in the state of Michigan back in March to where we are right now. So prior to the testing mandate that we had, we were observing early COVID-19 outbreaks occurring in dairies, food, meat, and egg processors, nurseries, and asparagus producers. And the numbers when COVID was found were quite large in some instances and were quite alarming. So in response, with the help from the governor's office and from a variety of state agencies, including our own MDHHS, MDARD, Agriculture and Rural Development, and LEO, Labor and Economic Opportunity, as well as local health departments, federally qualified health centers, and community action agencies, we established community work groups to work together to identify how we could be testing farm workers so that they would be protected. We could provide services to workers if they were found to be symptomatic, but also how we could make sure that they were serving isolation periods during their positive status so that they weren't transmitting it to others within their migrant camp or within their work site. So these community work groups got together, and initially our focus was voluntary testing. We tried to enlist some employers in voluntary testing. There weren't a lot of takers, and where we found employers that were willing to test it, even then the numbers of workers being tested was not great. And what we found was, resistance, and employers were, in the understanding position of having a very short turnaround for a harvest operation and not wanting anything to derail it. They didn't want their workers to get sick. They didn't want their workers to have to isolate. And we saw this also a reluctance from employees, partly because they take cues from their employers, and partly because they had their own ideas and resistance, and nobody likes to have a long Q-tip shoved up their nose. So there was resistance on that front. But in July, we began tracking agricultural outbreaks, July of last year. And what we were seeing was that the positivity rate in agricultural outbreaks was of concern. And the initial few employers that allowed us to do testing had higher positivity rates than what we saw in the general population. So in response, Director Gordon, who's the director of MDHHS, in conjunction with MDARD and working with others, formulated a public testing order, public health order related to agricultural worker testing. And this didn't come across, you can't come up with this out of whole cloth. It has to be an interactive effort. And so it involved leadership on the part of Director Gordon, seeing that these workers were particularly vulnerable because they were essential workers. They had no choice but to be out working out in, in the field, in the factories, in close conditions, and that if we're going to require or not protect them from that type of work, then we owed it to them to make sure that we were providing for healthcare. So again, Health and Human Services, MDARD, came together to look at it. We looked a lot at the nursing home orders that were in place to require testing of both the residents of nursing homes as well as the workers in nursing homes, and formulated the agricultural worker mandatory testing public health order. One of the large barriers that we quickly identified was that testing was going to be costly. At the time, the PCR tests that were being done were over $100 a piece for tests. And when you have a small farm and you have 10 workers, that's a lot of tests. And, if you're doing like for newly arriving workers, you have to test them at arrival, and then 14 days later, that doubles the cost. So there was a recognition and a willingness to support employers by providing the testing for free if they requested it from us. We didn't require employers to do that, but we gave them the option to say, okay, the requirement is not negotiable, but who pays for it is something that we can help with if you come to us for it. And we wanted to support COVID positive agricultural workers. So there were several initiatives that the department pursued to support COVID positive workers that we felt were very important for the success of testing. It does no one any good to test someone and then just kind of leave them to their own devices, continue working, continue interacting with others. And it also was clear from the director as well as from myself that it was unreasonable to ask workers to sacrifice their income for the sake of the public health of their fellow residents and camps and fellow workers, but also for the health of the community. And in that respect, the director agreed and was able to approve funding for up to $1,000 for farm workers who tested positive and agreed to isolate and follow local public health requirements. This was it was an approximation. It wasn't a complete, dollar for dollar recovery, but it helped people to get through that 10-day period when they couldn't work. In addition, our staff were providing support, making sure that they had enough food, making sure that they were able to isolate separate from others. And it was really important that we provide that level of support, making sure that their medical costs were going to be covered, because emergency services Medicaid, which is what's available to H-2A workers and undocumented immigrants, really only covered hospital expenses before. And last year it was increased to cover any COVID-related expenses, whether it was testing, whether it was outpatient services, or whether it was indeed hospitalization. So the testing requirement itself included a baseline testing, which was testing all workers that were already in place. The order came out on August 3rd, and so there were a lot of farm workers that were already in place. There were a lot of seasonal workers already in place, and the requirement applied to other types of year-round workers. So the idea there was to be able to see where we were and establish that sort of a baseline. And then the requirement also includes anyone who has COVID-related symptoms. And then, as well, as I mentioned before, newly arriving residents and new employees had to be tested. So who had to be tested? It was providers of licensed migrant labor housing, so any adults living in migrant labor housing, and anyone who employed 20 or more migrant and seasonal farm workers, meat, poultry, and egg processors, as well as nurseries and greenhouses. There were some challenges and ongoing concerns that have popped up since then. For instance, there was an October 3rd, 2020 Michigan Supreme Court decision, which no longer allowed the governor to issue continuing executive orders. And so a lot of executive orders that were issued previously by the governor were sunset and either had to cease or were folded in from public health orders. In this case, the agricultural worker testing order was a public health order, and it was issued by the Director of Health and Human Services, so it was not affected. We're continuing testing to focus, on testing and make that requirement, but also to expand and shift our focus to vaccination. In the months that we've had since the vaccine became available, a lot of work has been done with relation to vaccination, and Jackie Chandler is going to tell you a lot more about that, and we're really pleased to see where we're going with that. Also, we've adopted new testing methods, in particular antigen testing. So I referenced the PCR test where they stick the long Q-tip up your nose. This one's less invasive because you wipe it around the inside of your nose, and even more important than the invasiveness, although it's in the eye of the beholder, of course, but even more important to the invasiveness is the fact that antigen tests are quick turnaround tests. You're able to get results within 15 minutes. The PCR tests had, under ideal circumstances, people were getting overnight results, but those results often were stretching to 2, 3, 4 days. And then depending on where you were in the state, you could have as much as 5 days on a turnaround if your test was going a long ways and, depending on how it was shipped and so forth. So compare that to a 15-minute turnaround is incredible. The other piece with antigen testing is can be administered by someone who's not a trained medical professional. So what this allowed is for people to administer the test themselves, or for employers or managers of migrant labor housing to provide that test themselves. And this allowed them to have that kind of advanced testing so that their workers could get to work more quickly, and also so that for newly arriving farm workers to a migrant camp, before decisions were made on where to house them, the antigen test would indicate if someone was COVID positive, you needed to have them in isolation housing. So you wouldn't want to put them with other folks, especially other folks who haven't yet been vaccinated. In addition, for testing, we've expanded to include testing options at points of entry. And in particular, this means for us that the welcome centers in Michigan, and there's 5 of them in particular, have been equipped with a trailer that is able to do testing. Those welcome centers are throughout southern Michigan, from New Buffalo, in Coldwater, in Dundee, and in Monroe. And in the center of the state, there's also the Welcome Center in Clare. All of these are able to do drop-by COVID tests. And it's a great opportunity for workers who are on their way up north from Texas, Florida, or wherever they've come from in between, and get that COVID test before they get to the migrant camp. So we've contracted with a company called Honu to provide that testing service, and they're able to provide a printout for the farm worker to show that they've been tested. They're able to provide them with PPE in case if someone is positive, so that the people that they're traveling with can get some protection if they haven't already. And they're able to provide for registration in Spanish. Anyone can stop at this, whether you're a farm worker or not. If you're coming back from Illinois and you want to get a COVID test, you just pull in during the work hours, which are 10 to 5 p.m. or 10 to 6 p.m. I'm sorry. You're able to get that kind of a test for yourself, for the people that you're traveling with. But this really offers an opportunity for farm workers. And it's one that we're looking to add to as we're going along. Make sure that employers are aware of this, make sure that they don't have to call ahead, but it helps to call ahead, because then they'll know to expect you, and it just helps to know that you've got, say, a busload of 20 or 30 people coming, that they can prepare for it. So you don't have to call ahead, but they are asking that you do so. So that will be something that, if you're interested in, we can provide more information on. So looking forward, we're looking to revise the ag worker testing order, and there's potential areas that we should look to revise. For example, we need to have a recognition of those who are fully vaccinated. A lot has changed in CDC guidelines, and the state is responding to those changes. And so people who are fully vaccinated have a lot more freedom from testing requirements, from masking requirements, and so forth. And so I think the ag worker testing order needs to be revised to recognize that. We also need to build in items regarding sharing of positive test data with MDHHS. This is something where HIPAA can get can prevent FQHCs, federally qualified health centers, from sharing data about positive tests with us when someone tests positive. And even though that is something that would benefit the person because they would get access to supportive services that we provide. And then another item that I think really needs to be addressed is providing a path for workers who refuse to be tested. The way that it was structured previously and well, currently is that workers who test positive, or excuse me, workers who refuse to be tested aren't able to work for that large employer, and they just can't work for that person. So they, we need to provide a way for them to be able to serve an isolation period. So those are items that we look to, revising this order, and we're hopeful to get that, released soon. But and a lot of things happen. So we want to stay on top of what's going on with CDC guidance and stay in line with it. We'll have more to talk about when it comes to vaccination, but with regard to testing, this is where we are right now. So I will stop sharing. And Audra, should I then move to the introduction for our keynote speaker?